First, I want to begin by welcoming everybody, the league members and the guests that are here today. This is the March meeting of the Healthcare Issues team. We're part of the Bellingham-Whatcom County League of Women Voters. For any of those who are not familiar with our group, as our name suggests, we're interested in healthcare, and we try to keep ourselves informed about healthcare issues, what's going on. Due to the large number of people that are going to be attending today, I think there's perhaps 45, somewhere around there. We're going to ask that you put your questions in the chat box so that as many people as possible will have an opportunity to have their questions answered. And Chuck, I'll leave it up to you how you want to handle that. If you want to answer questions that come in or wait till the end of the presentation, that I'll let you decide that. So without any other information, I'd like to begin by presenting Chuck Prosper. He's the Chief Executive of PeaceHealth Northwest Network. This network includes St. Joseph's Medical Center, the one here in Bellingham, United General Medical Center, that's in Cedar Woolley, Peace Island Medical Center in Friday Harbor, and Ketchikan Medical Center in Alaska. And he began his career in healthcare as a physical therapist at the University of Pennsylvania. And he's held various roles of increasing management and executive responsibility in various healthcare settings, ranging from small community hospitals to large tertiary care facilities. And just prior to joining PeaceHealth, he served as the chief executive of Alta Bates Summit Medical Center in Oakland, California. And that's a multi-campus hospital enterprise, and it's part of Sutter Health in Sacramento, California. And today he's going to update us on PeaceHealth's services in the community, their expansion projects, and their plans for improving the health of our Whatcom community. So with that, I will turn it over to Chuck, and we're delighted to have you here today.
Thank you so much. I really appreciate that kind introduction. As someone who has been a Bellingham resident for the past 5 years, I have seen the advocacy, the educational work that the League of Women Voters does on a regular basis. And so I'm honored to be presenting to you today. I think it's especially important during Women's History Month to recognize the work that you all do as individuals to help educate the electorate in terms of issues and important issues for this community. We also recognize that in most families, there's a bit of a matriarchal relationship in terms of who manages the healthcare decisions. So we certainly want to respect everyone's queries today. I have set aside about 50% of our time to go over some background and history. I'm hopeful that that will actually answer a good portion of questions proactively, but I've also allocated the remaining 50% to be free-form Q&A. I have some colleagues who are with me, part of PeaceHealth and the PeaceHealth Medical Group, so that if I may not have the exact answer, we'll either be able to have one of those help us with some of those questions or to give you an IOU and then follow up with the group. I'm going to keep my chat history open, so I'll do my best to address questions. And I'm going to probably do that towards the end. Just so that we can kind of run through the slides and then drop it down and then be able to see each other more face to face. When I thought about our presentation, and I recognize this is Bellingham and Whatcom County, I also want to recognize, though, that the Northwest Network is an interconnected series of hospitals. And thank you for the introduction, because we have a critical access hospital in Southeast Alaska, in Ketchikan, Alaska, United General in Cedar Woolley, and Peace Island Medical Center in Friday Harbor. And so I thought it was nice in the spirit of springtime to have some images of long-awaited spring in our 4 communities that we serve. Next slide, please. Also inside PeaceHealth, we have a practice of doing a Coast Salish land acknowledgement. We, PeaceHealth, acknowledge we provide care on the traditional, ancestral, and unceded territory of Coast Salish people who've been the spiritual caretakers of these lands since time immemorial. The Coast Salish way of life, cultural values, and respect for the land and waterways are alive, strong, and resilient. We honor and accept the responsibility of being in continuous healing relationship as one people. This land acknowledgement is important for our caregivers and providers, but also those who come to PeaceHealth seeking care. We recognize the indigenous communities of the Lummi Nation, the Upper Skagit, Nooksack, and others who are in our care areas. And so that's an important part as we try to be our best community provider of being able to meet the needs of our patients as best as possible. Next slide, please. So here are some facts about PeaceHealth in Whatcom County. And this gives you a sense of how much we touch the communities as a sole community hospital, as well as an integrated medical group with primary care and specialties. I think the key things to highlight is that we had almost 70,000 emergency room visits. That's one of the drivers of our expansion project that I'll be talking about. We also delivered almost 2,000 babies, and we've done some improvements in being able to care for more families and newborns in our community and reducing the need for individuals to travel south for more specialized care. We have approximately 241 hospital beds, and we certainly used every single one of them during our COVID response over the past couple of years. And that's another area that is driving our need for an expansion. Our hospital runs at about 90 to 95% capacity every single day. And our caregivers and providers do an amazing job of helping to manage patients, meeting their needs, and then helping them to be discharged to our community in a timely manner. Our 3,400 employees are some of our most important resources, and we'll be talking a little bit about how we value and invest in our individual caregivers. Next slide, please. This gives you a sense of the size and magnitude of PeaceHealth in Whatcom County. Basically, we spend almost $2 million a day just to keep our operations going. $1 million of that goes directly to our caregivers for their salaries, wages, and benefits. And we also recognize, though, that we must remain an employer of choice, which means competitive salaries for our caregivers, focus on how we recruit and retain some of our top talent so that those individuals are here and their expertise is here to continue to serve our community. Next slide, please. Also, though, in community benefit, 10 cents of every dollar that we spend in Whatcom County goes towards community benefit. And so what that means is that there are services that we provide to everyone. Everyone, regardless of your insurance status, can come to PeaceHealth. Some payers do not yet pay us for the full cost of care. And so we recognize that for a Medicaid, for the patients that we cover that have Medicaid, there's essentially about $57 million where what we receive is short in terms of the total cost of delivering care. But either through our financial assistance programs or the open doors that we have in our emergency room, everyone is welcome at our PeaceHealth facilities. That's why we as a nonprofit provider have that charitable mission. We also invest approximately about $11.9 million directly in financial assistance And what that means is that we provide support for individuals who may have some challenges paying for their bill. And so from that standpoint, we recognize healthcare costs are significant in our nation. We also recognize that there are times where people feel like that they have good insurance, but there are times where there are co-payments or other out-of-pocket costs that cause challenges for families. And so we're very proud of our financial assistance program. And I think there's just a little bit of a math error, or a little bit of about 783,000 is community health improvements, and there's an M there. That should be essentially K for thousands. So we put in approximately $783,000 for cash and in-kind contributions. Next slide, please. And what that looks like, we focus our investments in direct care. So 235,000 in advancing community connections. So that's where we rely on partners to help extend their services to residents of Whatcom County. We also invest in local education and training and prevention of chemical dependency. So we look for ways that we can address the community needs and substance abuse disorders. We also provide monies for direct housing access. One thing that we see is that individuals come to our hospital, but then they may not have a stable living situation. There are times where someone may be returning back to an unstable housing situation, or they may be homeless. And that's where we partner with community agencies to help find options and transition people into housing. And then finally, we work to address food insecurity. So partners like the Bellingham Food Bank and other entities where we might enhance not only direct food on people's tables, but also where we might do educational program in schools where we highlight how good nutrition improves your health for the long term. We also provided almost $500,000 in unique community impact awards in these 4 categories. So each and every year, we allocate about $400,000 for community benefit, and we support additional community health impact awards. The most, and that can include things like partnering with housing developments, partnering with unique interventional programs, so that we are constantly investing in the overall health of Bellingham and Whatcom County. Next slide, please. And this is just a quick picture of our Northwest network. So we serve 3 counties in Washington State: Whatcom, San Juan, and Skagit, and then our Ketchikan Borough in Ketchikan, Alaska. Next slide, please. I spoke earlier about the amount of activity that goes on in our hospital and how we operate at capacity. I think if anyone has come to our emergency department, we recognize that there are times where the wait in the emergency department can be a bit of a challenge. We don't believe anyone should have an extended wait in the emergency department. And so when I talk about the ecosystem of us being able to help and engage with community partners, it means that we can actually help discharge patients to the safest possible environment. So a bed upstairs in the hospital could then be available for the next emergency room admission. We also have innovated inside our emergency room to have faster patterns of care so that we're utilizing a fast track area. So if you don't require a private room in the emergency room, if you don't require a gurney, and that you could instead be treated in a recliner chair, it's a faster, more efficient way to deliver care to the individual and then help facilitate their discharge. So the next person waiting in the emergency room lobby will have a lower waiting time. But we recognize that these are just operational improvements, and so we are in the midst of going through the City of Bellingham Planning Commission approval process to add a new pavilion to the existing St. Joseph Medical Center. It's the Peter Paulson Pavilion. We had the benefit of a recognized leader in the Bellingham community, Peter Paulson, who developed the Bellwether Hotel, but also developed other projects here and across the nation. He came back to our community and recognized the need, and he really was a lead donor in helping us to get this project off the ground. It represents 120,000 square feet of additional space, acute care hospital space. It will provide 80 new acute care beds, including labor and delivery, pediatrics, and a neonatal intensive care unit. And then it expands our emergency department to be about as big as it possibly can be, given our estimates of demand going forward for the next 20 years of healthcare services in Whatcom County. It also integrates the rooftop helipad. And so for those of you that may have had a family member or friend who may have come into our hospital by a life flight helicopter, the method today is that someone lands on the ground helipad, and then there's an ambulance that takes about a quarter-mile trip from the helipad around the hospital to the emergency department to hand off to the emergency department team. We, with the expansion of the pavilion and the helipad on roof, will be able to eliminate that middle step. So taking us from already very good care to exceptional care by reducing that time interval. What that also means is that patients will not receive a charge for that ambulance transport, and that ambulance, who sometimes waits for that patient, would be available out in the communities to serve other needs. So this is a very important game changer for us. The other thing I'd like to highlight is that our development of pediatrics and neonatal intensive care unit will actually enable more patients and families to stay in our community. When I arrived here 5 years ago, if a child was 34 weeks in development and came prematurely, we would be able to care for that baby in our facility. Over the past 2 years, we've actually improved and enhanced some of our investments in more advanced technology, staff training. And so now infants or newborns that are 32 weeks of gestation can now be cared for safely in our local community. 2 weeks may not seem like an advanced number, but what it does is it allows more families to stay within Whatcom County. It reduces the need for a newborn, their parent, or their family to be sometimes split between living in Whatcom County and receiving care at Seattle Children's. And so from that standpoint, every investment that we're making in our bricks and mortar will actually help us to continue our clinical advancement pathway. So in 5 years from now, the gestation period might go from 32 down to 30. It's all going to be based on the needs of our community and the skill and training and the resources of certain specialists who are focused on neonatal care. But in making that investment in the new building, it means we'll never be limited by the bricks and mortar. And so we have a strong path of clinical advancement in our community, keeping more families and kids and newborns locally. We'll also be creating a larger dedicated pediatric unit. And so once again, for those individuals who can receive care locally, it'll reduce the need to go south. We do not anticipate that we will replace the need for Seattle Children's or specialized care that exists in Seattle, but our goal is to create more of those investments and resources here locally, so there'll be less needs for individuals to travel. Next slide, please, Karen. This is just another rendering of the pavilion. This gives you a sense. It's basically taking our north and south towers that you see today when you walk in. through the main entrance. And that main entrance will be replaced by a third pavilion or a third tower. And this is how it'll look from the traditional front entrance of the hospital. Next slide, please. As we embark on the building of that new pavilion, we have a need for capacity for parking. And so that's an immediate near-term investment. Our parking garage has been under construction for a little over a year, and we anticipate it opening in May. This will increase our parking capacity by 400 new parking stalls. It'll allow parking for the hospital, adjacent clinics, as well as for our caregivers and providers. It will also include electric vehicle charging stations. Next slide, please, Karen. And this is just one more rendering of the garage. And our goal is to keep it as friendly to our neighbors. We have a senior residential facility. We have a skilled nursing facility. We also have neighbors towards the south on Plymouth and other adjacent streets. So we wanted to also have screening to reduce any perception of light exiting from the garage and perhaps creating a bit of a nuisance for anyone as in their home. So our goal here has been to focus on really being a good neighbor at all times. And so we'll be having some screening that'll make the garage as good looking as possible. Next slide, please, Karen. We recognize, though, this group is interested in healthcare for all of Whatcom County. Our PeaceHealth Medical Group is opening a new clinic in Linden. It will be a new venue which will provide much needed increased access for primary care and specialty care. It will also have a same-day clinic or urgent care type clinic, as well as advanced imaging in that community. We think this will be a significant improvement for those folks who live in the North County, so that their ability to receive health care without driving down to Bellingham will be enhanced. Next slide, please. I spoke earlier about the importance of our caregivers, and we are very focused on the professional development of our nursing and other caregivers. So I thought I'd talk to you just a little bit about our professional nurse advancement program. We already do an exceptionally good job of welcoming new graduate nurses into our facility, providing to them a very in-depth orientation and residency program. But we recognize that we have to create a venue for individual nurses who are interested in developing their skills, in advancing their practice capabilities, have a place or a pathway for development. And that's our professional nurse advancement program. That supports individual nurses in the pursuit of either advanced degrees, advanced certifications. Our goal is to meet as many professional career development needs under one roof so that a nurse would have the ability to spend their career here at St. Joseph Medical Center, that they would feel that they are constantly supported and challenged for as much as they would like to do in advancing their clinical expertise. We actually have a fair number of nurses who are master's trained and more who are at the doctorate level. And so from that standpoint, that investment in caregivers means that those caregivers stay inside our community. And then finally, we hope to expand that and really continue to develop through a Institute of Nursing Excellence, the culture of exceptional nursing and creating the best possible environment from a patient care perspective. And so those two pieces together, I think, are just one small example of investments in our caregivers so they stay in our community and we all benefit from their expertise. Next slide, please, Karen. And finally, this is one area that we're very excited about. This is one of the newer community-facing partnerships that will be evident this fall of 2024. In partnership with the county, Unity Care Northwest, and the Opportunity Council, we are a participant in the Way Station. And the Way Station has multiple services within the facility. It's located on State Street in Bellingham, near downtown Bellingham. And PeaceHealth's role in partnership with Opportunity Council will be the creation of medical respite beds. And these are not skilled nursing beds. These are not long-term care nursing home beds. But these are beds for individuals who have received care at our facility, who may be homeless or have unstable housing situations, and they need a place to go and recuperate. They no longer need acute care hospitalization, but they do need additional support for them to continue their healing journey. And so what this will be is a 17-bed residential facility where they will not only have that safe environment to recover from their medical condition, but also they'll be able to have direct access to housing resources, social services, as well as visiting nurses and home health should their condition require it. And so we're very excited in this investment. It's another example of community benefit where our goal is to improve the health care of our entire community. And with that, I'm going to just pause and get a quick drink of water since I've been talking for a while. Take a look at chat, and we'll start going through some of the questions. So just one moment, please.
Chuck, this is Amy. Would it be helpful if I started at the top with some of the questions?
Amy, thank you for your help. Let's see here. I've actually got a pretty open chat window, so I'm going to do my best to go through it if that's okay. But thank you for the offer. So the first question that came in was, I'd like to know about the status of PeaceHealth's direct contract entity, the capitation program, which is private for-profit corporation. And so what I want to do first is just to have Karen put into chat a link to the program that is of question. Cascadia Community Care Alliance is the name of the ACO. And what this is that this is designed to be in line with a Medicare program called an Accountable Care Organization. And that is a program that's designed to be an additional model for individuals who have Medicare to receive services in a different model or a different mode. And the way I would describe this is that because Medicare is constantly looking for ways to innovate, to deliver Medicare beneficiaries their benefit in a way that is designed to maybe reduce some utilization in some areas, but then to be creative and thoughtful in helping individuals to receive access to other services. So an accountable care organization is really designed to help deliver Medicare benefits in a different way, in a way that under CMS, or the Centers for Medicare and Medicaid Services, under their rules and guidelines, to find ways to perhaps improve on the traditional delivery of Medicare. What I will say is it is a not-for-profit organization. So the person who queried said, it's a capitation program, which is a private for-profit corporation. That is not how the PeaceHealth model is set up. It is set up as a direct contracting entity or an ACO, but the PeaceHealth design is to maintain a not-for-profit and not-for-profit objectives. And so what that means is our goal is to improve access to health care for those Medicare beneficiaries. And so Karen is going to be putting into chat the link so that you can actually go to the PeaceHealth website. It's a great resource and has some FAQs so that it should be able to help you. Let's see here. I'd like to welcome some of the folks who've identified themselves in chat. So Dr. Dakota Lane, who's a PeaceHealth Community Board member. Thank you for being here today, Dr. Lane. Donna Inglis, who's our Foundation Board Vice President and also a liaison to outpatient palliative care. And so then I think what I'd like to do is go into the next question. And there were some queries about the billboard expenses, monthly full-page ad, and many local publications. Here's the answer to why we still put our message out. The goal, like any healthcare organization, is that a certain amount of our expenses are designed for advertising or communicating services that we deliver. It's standard for every healthcare entity to do some degree of messaging. I will say that the PeaceHealth messages have evolved and will continue to evolve. What we want to do is we want to highlight that there are exceptional providers and expert care local and available in your community. As we open the Linden Clinic, we will actually take ads out to help individuals to learn that there's new presence of PeaceHealth. What I will also say, though, is that we're also extremely careful about how we spend dollars. And we strive to be good stewards in everything that we do as a nonprofit entity. What that will mean is that some of the most effective and inexpensive ways to get our messaging out is via Facebook. So all of our communities have very active Facebook presence. That's a very efficient way to get our message out. Also, for every time that we have a new development or something that is positive from a program standpoint, we will also issue press releases so that if local organizations choose to pick up that information and share it, that's another effective way to be good stewards of our resources and still perform the necessary task of getting our message out there. There was a question about patient satisfaction surveys. And it says, the query says, I'd like to see the results of the patient satisfaction surveys since they began, referencing the ads. That's not a question that we actually would expect. Our patient satisfaction surveys are based on individuals who've received care. And those patient satisfaction results are available at Medicare.gov, where there is the ability to do hospital comparisons. And so from our standpoint, we have positive patient satisfaction results, but we always want to improve the experience of care. So in addition to the patient satisfaction surveys that we do, we also look at the individual comments. And from those individual comments, we take specific actions to improve our services. Sometimes it's related to wait times or how effective our telephone systems are, or how well our providers take time inside an individual encounter and communicate with the patient and their family. The ability to essentially take the time and answer the needs of the individual receiving care. So once again, Hospital Compare, if you Google search Hospital Compare Medicare.gov, you'll find patient satisfaction results. We have as I said, a strong performance record, but we are working on continually improving those results. What efforts are being made or have been made towards getting subspecialists? I'm thinking specifically of movement disorder specialists who care for people with Parkinson's. So for that specific question, that would be in our neurology department, or where we have neurologists as part of PeaceHealth Medical Group. Speaking more broadly, we are constantly recruiting for additional providers. We have some of the best cardiovascular physicians in our community and in Northwest Washington, but the demand continues to grow. Whatcom County is a growing community, so we continually recruit, number one, to improve access to primary care. Number two, to provide access to those services most commonly needed by our general population. And that's typically seniors or individuals who are getting, who are beginning to utilize healthcare more readily. And so that includes orthopedists, general surgeons, as well as OB/GYN. And so from that perspective, what I'd like to do, if I could just, are Denise or no, actually, my colleagues from the medical group are not on.
Chuck, I made it on.
Oh, Dr. Boxler, yeah. So I was wondering if you could maybe expand upon kind of our approach when it comes to our recruitment of providers and how important it is for us to grow with the community.
Yeah, we we monitor very closely the wait times, and I see several mentions of wait times in everybody's chat, which we understand is an issue. And when we get a certain wait time, we meet with that individual department or specialty and then decide what it is that they feel they need to recruit for. For the specific question about movement disorder neurologist, that is somebody that we would really love to find. Just so everybody knows, neurology has been probably the hardest specialty for us to recruit. It takes a very long time. There's not very many of them. And we are recruiting actively for neurologists right now. But as Chuck was saying, we have active recruitment in primary care, certainly to augment what we have here in Bellingham, but also to improve and grow in Linden when we open that clinic. And basically just about all of our specialties that have a fairly long wait time, we are actively recruiting. That's all in the context of projected national shortages of physicians. We're very fortunate to live in Bellingham, so I think we're attractive, but we're not immune to those kind of forces. So I was just looking at our list of open recruitments in Bellingham, and I believe it's about 20 to 25 positions that we're openly recruiting for, and that's a variety of both surgical, medical specialty, and primary care physicians. So, Chuck, I hope that answers the question that you're hoping I would get to.
Thank you very much, Dr. Boxler. I think the only thing that I might add is that when we recognize that there is a specialty that might be needed or new in our community, such as the colorectal surgeon that we're currently recruiting, or the oncologist with gynecological specialization, that those are not always typical in a community. But as we grow in size, we recognize that these are at least two specialties that are part of our active recruitment. So the oncologist with specialization in gynecology, that is actually a confirmed recruit who'll be coming to our community soon. And we are looking for a full-time colorectal surgeon. So that's a very, very specific specialty and a great addition to our community.
Right. You brought up a good thought that I didn't mention, Chuck. When we have an issue that comes up from one of our clinics about recruiting, we don't just look within, but we also talk to our community partners to find out what they're doing and make sure that we really aren't competing, but that we're trying to fill the community need. Several of the specialties that we are recruiting for, we have discussions with our community partners first, and then we decide, gosh, I think we're the best ones to recruit and will likely be most successful. So I wanted to throw that out there as well, because we really try and take a look not just at what we're doing within PeaceHealth, but how we're serving the community, and that includes all of our important community partners as well.
Thank you very much, Dr. Boxler. I'm going to jump on to our next question. We've been concerned about private equity firms gaining control over healthcare. In a couple of years, Scott Foster assured that PeaceHealth was not controlled by an equity firm. We know that Team Health is a private equity firm employing the ER doctors. What other areas of care is owned by PE? It's been documented that when PE takes over, quality of care decreases. So first of all, since this question is really around quality of care, and it is accurate that Team Health is a private organization, and Team Health provides our emergency room physicians. But separate and apart from someone's business structure or employment structure, our medical staff and our community health board oversees the quality of care that we deliver. Our organization has publicly reported quality outcome measures, and we excel in a number of areas such as cardiovascular services. The start for treatment of a heart attack begins either in the field when EMS brings someone in, or the rapid diagnosis of a condition of a heart when someone comes into our emergency department. So the quality of care is not governed by ownership structure. The quality of care is governed by the performance and the quality measures that we continuously monitor inside the hospital. If there was a concern about a group's performance, then we would address that inside our medical staff and hospital quality structures. We have a number of groups in our hospital that are tried and true, privately owned entities, but they're owned locally or governed locally by physician groups. They're physician providers who are in business for themselves. So the distinction and trying to draw a connection between private equity and hospital quality is not the driver. It's our own quality measures. We have some of our long-standing provider groups that are not provider equity that are exceptionally good. So Team Health, who serves our emergency department, does very well. Our anesthesia group, our radiology group are also private entities. They're not private equity, but they also do exceptionally high quality care. So I'm really proud of our medical staff and how our medical staff ensures that physician provider quality is always on the upswing. And if for some reason we were dissatisfied with an individual provider group, we would work to let them know that they should make those improvements. And if those improvements did not occur, we would look for an additional way to still meet the needs of the hospital and perhaps not utilize that group any further. But at this point in time, we have very good satisfaction with all of our physicians on the medical staff. The next question that came up is, what's the relationship between PeaceHealth and the local Catholic diocese and the regional Catholic organization? There's also a kind of a companion question about the religious directives and how does PeaceHealth follow the ethical religious directives. So I'll just try to answer those together. So PeaceHealth is recognized as a private juretic person, and that's a kind of a unique designation. We, PeaceHealth, has its accountability directly to Rome and does not have responsibilities or is governed in any way by the local Catholic diocese. We still are very respectful and connect and coordinate with other healthcare institutions like Providence, like CHI, who have a more direct have a more direct responsibility to the local diocese. What does that mean when it comes to ethical religious directives? And so first and foremost, PeaceHealth believes in alleviation of suffering when someone's at the end of their life. We always work to keep individuals at that very difficult time comfortable and respecting their wishes. And so from that standpoint, we do not necessarily make it more difficult for someone at the end of their life. What that also means, though, when it comes to perhaps the encounter inside the relationship between a doctor and their patient in an outpatient setting, we respect that private conversation between the patient and the doctor. If there is a need for a service that PeaceHealth does not directly perform, we then ensure that that patient receives the navigation and the support to find the right referral to receive the care in the way they wish to have care delivered. Dr. Boxler, is there anything you'd like to add to that answer?
No, I think you said it very well. When I joined PeaceHealth, we had one of the sisters come and talk to us, and they felt that the relationship between a provider and a patient is pastoral, and we take the thoughts that are contained in the ethical and religious directives with us, but then we make the right decision for the patient in that moment. And I think that's been carried through with all of the clinicians that I know of. And I came into PeaceHealth with 92 other clinicians, and I think we all were pleased with how we could continue to practice medicine in the way we were accustomed to help care for our patients in the best way possible.
Thank you, Dr. Boxler. One question that came in and said, will the planned neonatal unit be run in-house or by a for-profit entity such as the ER? Just for a clarification, all of our hospital-based services all fall under the not-for-profit status. Anyone who receives care is eligible for our financial assistance program based on their ability to pay or other extenuating circumstances. So there really are no for-profit entities inside our hospital operations. Let's see. I'm just going to try to move through the questions because we're coming towards the end of our time. There's a question about our system board of directors for PeaceHealth, and recognizing it says, I'd like to know why the board of directors of PeaceHealth has representation from states that do not have a PeaceHealth facility, and yet Whatcom County has no representation on the board. So first of all, I'll just talk about a large healthcare organization like PeaceHealth. The system board, first and foremost, is that they want to look for competencies. And so individuals on the board who help with governing decisions, they seek out individuals who have competencies unique to healthcare and unique to organizations the size of PeaceHealth. So there are times where you may look at the board roster and see someone who has a home in California, but they're actually someone who's worked with PeaceHealth for many, many years and has great expertise. We have two board members who are also part of Common Spirit, another Catholic-based healthcare organization. So they also bring great competencies to the board. So first and foremost, it's really a competency-driven board. And so that means that you don't necessarily have state-by-state representation where PeaceHealth has a footprint. But because some folks have worked with us for many years and they've moved, it means that they've actually had a relationship with us in Washington State, for example, but live in California today. The request from this community about having an additional voice from Whatcom County has been shared with our leadership. They are contemplating that just like they contemplate the competency and the background of any new member who might be joining our system health board. What I'd also like to say, though, is our local community health board is absolutely representing you. And those individuals bring lots of expertise in terms of healthcare delivery and community representation in Bellingham and throughout Whatcom County. And so our local community health board is also very important in giving us guidance and governance advice. That also extends to our Whatcom Hospice Foundation Board, as well as to our PeaceHealth St. Joseph Foundation Board. Let's see here. There was one question about why am I unable to discover if I'm enrolled the PeaceHealth ACO or the direct contracting entity. I'd like to suggest that you spend time looking on the FAQ section of the link that Karen put into chat. That should give you the information on how you'd be able to validate your direct participation. Another question says, you've told of many structures building you are erecting or buying, but shutting down your asthma and allergy clinic completely, which has impacted this individual's family directly. And the question is, would you justify your evaluation that more clinics or buildings were more important than keeping a local asthma or allergy specialist department? What I'd like to do is frame that question a little bit differently. We as a healthcare organization continually make service changes, and we continually make new investments. And I will say that our investments in provider specialty, our investments in additional clinical resources, in nursing and rehabilitation services, in additional programs, including home health and hospice expansions, actually are serving more individuals in our community. And so we don't want to minimize in any way individual impacts, but we are constantly evolving. And for a large healthcare organization that's constantly responding to changing demand in our community, it's going to be normal for certain things to be emphasized and other programs to be de-emphasized. So that in no way is meant to be a critique of any individual specialty. But when we try to make our decisions, we make those decisions with the global impact and how it can serve the most patients and create the greatest access for all. Jim, is there anything else you'd like to add with respect to that specialty question?
No, I think you reframed it when I said that. When I saw that question, it's very much we try and prioritize things for the long term and the benefit of the most people we can serve. And there's resources that go into all of these. And I will say that the specific of asthma and allergy was very resource intensive. That wasn't the reason that we opted for the decisions we opted for, but it was much in alignment with what you said, Chuck. We think that this will actually serve us better in the long term, and we've been able to work with those clinicians to keep them in the community as well, which we knew was a possibility.
Thank you very much, Dr. Boxler. I'm going to just try to answer the last couple of questions in the time that we have. I do see some very specific questions related to the ratio between MDs and physician assistants. I also see a query about perhaps a follow-up individually. So Amy Drury, who came on earlier today, she's keeping track of all of these and helping to identify where we might need to do some individual follow-ups. One question that came up, though, is PeaceHealth compliant with the Federal Price Transparency Act? We are. We make, not only at the federal but state level, our prices available. So if you had a procedure coming up or you were wanting to know what might be your anticipated cost for the procedure, what might be your anticipated share of those costs, our financial assistance team would be able to help you and walk you through that on your own specific situation. And so all of our prices are available and visible. And if you had individual questions about what your own share of costs might be, that's exactly when our financial assistance counselors would be able to give you individual answer. I think with that, I see we are at 10:58. We have done our very, very best to answer as many questions as possible. We will be doing some follow-up and provide some answers back to the League of Women Voters. I'd like to thank everyone, Dr. Boxler especially, who came on and helped with some additional answers, but also appreciate everyone's questions and communication this morning.
We would like to thank you too. We very much appreciate it. This was very helpful, very informative, and I would encourage you to do this again, and not just for our group. There were 38 people here today. That's a small part of Whatcom County. Do it again for different groups. There's lots of questions out there, and healthcare is important to all of us, and we really want to know what's happening, what's going on. We want to be part of this. And thank you so much for coming today. We appreciate that.
Absolutely. Our pleasure, and happy to come back at any time for a regular update. So thank you.
Thank you.